Hello, Diaz here, founder owner of Greenwood Dental. Today we're talking about one of the most common questions I get every single day. Before I go through the question, let me just give you a summary of how we diagnose you guys when we say that you're coming every 6 months, you're coming every 4 months, you're coming every 3 months. There are 4 tools that we use to collect data. The first tool is, as you know, the x-rays. The second tool is the perioprobing, which is the measurements that we do around your gums to figure out how healthy your gums are. The third tool is observational data, when I come in and look in the mouth, and when the hygienist come in and looks at the mouth and figure out you have a buildup in the front, you have buildup in the back, you have high buildup. Healthy plaque buildup should not be more than 10 to 15%. If you hear your hygienist say you have 30%, 35%, even 20% buildup, it means that there's something that has went wrong during the 6 months period we did not see you. So observational data is your third tool. Your fourth tool is the iTero scan that we do on top of the x-rays. Yes, the iTero scan is for evaluating and assessing your occlusion, your habit of clenching and grinding, wear on the teeth, the top of the teeth, recession, check my recession video. And those 4 tools, we collect all the data that comes out of these and then reassess you and place you in the correct or needed recare program. And there are criteria, there's standard of care criteria. Some patients land on 6 months, meaning that within the 6 months, we are not anticipating any changes in your mouth that will require for our attention. Some of you will need us every 4 months, meaning that in 4 months, that specific patient will require us to check and reevaluate their condition because things might change. Some of you will require us in 3 months. Now, the 3 months and the 4 months category patient could be one of 2 reasons. The first reason, if you had a history of deep scaling or deep cleaning, that's a common term for it, or you had a history of periodontal disease that you were under a periodontist care, you have to continue the maintenance every 3 or 4 months, depending on what the periodontist opinion is, and we'll figure that out for you. Obviously, if you're a new patient, we'll contact your periodontist or we'll look into your history. Now, if you end up being diagnosed with periodontal disease and got the treatment with us in our facility, then the hygienist, depending on how you are healing, you have to come as a recare every 3 to 4 months. Periodontal disease cannot be cured. We treat the pockets to keep the disease under control so it does not progress and continue damaging your bone and your gums. Now, the same bacteria, that 6 billion bacteria in the oral biome, check my other video again, that help us keep the mouth in balance can cause the damage with the right conditions. So for somebody that is prone to periodontal disease, whether genetically, whether medication related, whether healthcare, or whether health conditions, whether it's just home care, and get the deep scaling, you cannot wait 6 months. You are just going to start where you finished. And restarting again, unfortunately, periodontal disease, if it comes back with vengeance. It comes back a lot and more aggressive and more damaging. So it's very important, if you have a history of periodontal disease or you had a history of deep scaling or deep cleaning, you have to stay within the 3 to 4 months recare, no question about it. Waiting 6 months, you are setting yourself up for the disease to come back, more bone damage. And remember, the bone that you lose, we have no way of bringing that bone back. All we can do is turn the diseased bone into a healthier bone and hope for the best that you don't lose more bone. As a result, you won't lose teeth. That's the goal. I hope that clarifies things. because I'm getting a lot of questions and pushback. I'm like, Dr. Slava, I only want to come every 6 months. I can't afford it. Or Dr. Slava, why do I have to keep it coming every 3 or 4 months? I've been coming for years and years and years. Unfortunately, you have been categorized with that disease. We've been diagnosed with that disease, and that's what the disease need to keep it under control and in check every 3 to 4 months. I wish I have a different way of doing this, or a better way of doing this, or easier way of doing this, but it is what it is. This is what the science tells us, and that's what the disease is requiring from us to do and care for you. Thank you for watching. Be well, be safe, we love you, and DS out.